Good afternoon, folks. Today's topic A is the cost of dementia care. Okay, we're discussing the cost of dementia care when it comes to family finances. So, with that being said, let's go with today's discussion A. I just put today's topic up for y'all to discuss. So, let's go with the show. Okay, families are losing homes and lifelong savings because dementia care costs have risen so sharply that many people must self-fund until their assets are nearly gone. What look what looks like a simple headline is really a window into a system that forces ordinary families into extraordinary financial sacrifice. What the headline is really saying, from sold homes to lost savings, the cost of paying for dementia care isn't just a story about money. It's about structural reality shaping thousands of families, lives across the UK, and increasingly mirrored in the US. It signals three intertwined truths. Dementia care has become so expensive that families routinely liquidate assets, including the family home, to keep a loved one safe. This isn't a rarity. This isn't a rare tragedy, it's becoming the norm. Local authority funding has not kept pace with the real cost of care, leaving councils unable to cover what providers change or charge. The the gap between what care costs and what the state pays has widened into uh, some people are entering care later with more complex needs. Because families try to cope at home as long as possible, but the time residential care becomes unavoidable, the level of support required is intensive and priced accordingly. This is the quiet crisis beneath the headline, what the reporting highlights. Families are burning through savings at alarming speed. The The Shrewsbury example is striking but not unusual. A daughter describes her parents' combined dementia and nursing needs costing nearly $12,000 a year, a figure that would wipe out most families' lifetime savings in a matter of months. What's especially painful is that many families had planned carefully, modest pensions, savings built over decades, a, ho- a home meant to be passed down. But dementia care costs can devour all of it. The home becomes the next asset on the chopping block. Families often describe this moment as a second grief layered on top of the first. Why homes get pulled into the equation. The financial the financial assessment rules in England are blunt. If a person has more than 23,250 in assets, they must self-fund their care. The family home counts as an asset unless a spouse, disabled adult, child, or other protected person still lives there. This means the house, often the only major asset a family has, becomes the de facto care fund. Families who believed they were leaving a legacy instead watch it evaporate to cover basic safety and supervision. Costs are rising faster than public funding. Residential dementia care fees have climbed about 25% in 5 years, driven by higher staffing costs. Energy and food inflation. Recruitment challenges. Increased medical complexity among residents. Meanwhile, councils are drowning. Adult social care now consumes two-thirds of some local authority budgets, leaving little room to increase payments to care homes. Providers say the rates councils pay don't cover actual costs, so they rely on private pay families to lift or to fill the gap, a practice known as cross subsidy. In other words, self-funded self-funders are paying more so the system doesn't collapse. The system is widely seen as broken. There's a painful mismatch between what families expect and what the system actually provides. Many assume dementia, a medical condition, will be covered by the NHS, but NHS continuing healthcare, the only fully funded option, is notoriously hard to qualify for. The bar is set so high that even people with advanced dementia are often deemed not medically complex enough. Care providers, charities, and economists agree social care has been underfunded for decades, and families are now absorbing the consequences through personal financial ruin. Why this matters. This isn't just about individual families losing homes, it's about a society quietly shifting the cost of a major public health issue into private households. The result is a form of generational loss. Homes sold, inheritance erased, retirement plans destroyed, adult children drained by caregiving and financial strain. Dementia is now one of the leading drivers of late life poverty in the UK, and the US is not far behind. How families can protect assets within rules. How NHS uh, continuing healthcare really works and why so few qualify. What US families face with Medicaid spend downs and long-term care insurance. How to talk about this in a podcast or educational segment for caregivers. Okay, guys, that's your A for today. I will be back on in a bit for B. Give me a bit for a break, please. I will be back on with B shortly. For now, Gator Wellness. Take care, folks. I'll see you in a bit for B.